coming in, but I think we're going to get started. It's me, it's Ruth Ann Fuller here at City Hall, and it's just great to be together virtually. I wanted to say how grateful I am to Jane Colino and her team at Senior Services and our fabulous Council on Aging for bringing us all together tonight. We are all still grappling with such difficult questions. How do we make sure everyone stays safe? And how do we help people emerge from the hibernation that we've all been in and feel safe, even when we haven't discovered a vaccine yet for COVID-19? And we know particularly the data all shows that for our older residents, this has been a particularly difficult disease. I also want to say thank you to Lisa Samuelson. She's both a member of our Council on Aging and comes with a great expertise. She's an epidemiologist at the Heber Senior Life Marcus Institute for Aging Research, as well as at Harvard Med School. And she's going to be our moderator. Thank you, Lisa. And I would also say we're being joined by Dr. Michael Mina. There's a group of mayors who've been meeting really regularly since the very beginning of COVID-19, and Dr. Mina has been really generous with his time. He comes with, you'll see how wise and thoughtful and knowledgeable he is. No surprise, he's an epidemiologist plus an immunologist plus a doctor at the Harvard School of Public Health and at the medical school. And he's certainly been helping all of us through these uncharted waters. Thank you, Dr. Mina. Thank you, everybody else. It's good to be here. And I'm not sure who I'm handing it off to, but Alana will figure it out. To you, Lisa.
Great. Thank you, Mayor Fuller. I'm so pleased to be here tonight. I would also like to thank the Newton Council on Aging, especially the chair, Donna Murphy, for inviting me to moderate tonight's discussion. The coronavirus or COVID-19 epidemic has taken a particular toll on older adults in our community and worldwide. Risk increases with age, and residents and staff of nursing homes have been devastated by coronavirus disease throughout the United States and the world. COVID-19 is a new virus, and new knowledge is rapidly acquired each day, along with constantly changing and much too often inconsistent messaging. The newness of the virus, coupled with massive amounts of information to absorb, is unsettling and often overwhelming for all of us. Tonight, we hope to address the concerns of many older adults with respect to keeping safe as we re-engage with our community as the Massachusetts economy reopens. Over the next hour, Dr. Mina will answer the questions that many of you previously submitted when registering for this meeting. Please know that this program is being recorded and will be available to the community. Due to the high volume of participants, we've had, I believe, over 300 register for this event tonight. We will have to have everyone on mute, and the chat will not be available throughout the program. If you do have any further questions or concerns, please contact the Newton Senior Center, the Newton Health Department, or your healthcare provider as appropriate. Now it's my pleasure to pass the microphone over to Dr. Mina, who has worked tirelessly to improve prevention of COVID in older adults and in nursing homes across the state. Thank you.
Well, hello, everyone. Thank you for those of you who are joining and tuning in. Thanks for coming and learning about this virus, and hopefully, my hope is that through this session you can get answers to the questions that you've been wondering about, and I hope to give you information in a way that you can that's interpretable, I am a scientist and I'm a physician, so sometimes my language, goes back into the scientific type of language. If that happens, you can type in the chat and tell me to use other things, speak more clearly. But I will do my best to hopefully answer all of your questions. So I do want to say I think that this virus, it's been a challenge for everyone from day one, and it emerged in China back in late 2019, somewhere in October, November, and has obviously spread everywhere, and it's affected everyone. And I think, the hardest hit and the most affected have been, of course, senior citizens in really across the globe. And I do, it's one of these rare events that, as far as I can tell, it's truly a rare occasion when you see something that is able to bring the whole globe together. And it's usually things that are not necessarily positive that bring the globe together. And this is one of those. And, so I think I've just had an opportunity to speak to, in the last few months, to speak to presidents of countries and leaders all around the world. And it's been astounding to see how similar the plight has been across the globe for everyone. And I think for all of you, I don't know your ages here, but I can get an idea that you're not the most junior of people. And I think that, I can only imagine that this is not an easy epidemic for you to have to deal with, given, just how scary it can be. So I want to, I hope that I can do my best to answer your questions. And I think we will kind of dive into some question and answer.
Okay, great. So I think what we'll do here is I will put the question up on the screen, and I assume that you all can see that at this point. That's great. So our first question, maybe the most basic and complex at the same time for Dr. Minna, is why are older adults at such high risk for infection from COVID and for having a more severe clinical course?
Yeah, this is a very difficult question. And the short answer is we don't have all of the answers about this virus at this point in time. But what we do know is that older adults do tend to be, they are already usually at a more fragile state in terms of their immune systems. So sometimes immune systems normally help to fight off viruses like this. But with this particular virus, it seems to be able to grow inside and replicate inside of people very well. And if you don't have an immune system that's sort of ready to and able to really fight it, as much as a younger individual, sometimes that's one of the pieces that's leading to just such devastating outcomes. But there's also additional factors which we're trying hard to understand. We know that this virus has an interaction with cardiovascular disease. And that's because how the virus interacts with humans is actually, it tends to tamper with the pathways in our body that are responsible for keeping our cardiovascular system in check. And so we believe that it probably has something to do with this very complicated interaction between the virus, how it infects our actual cells of our bodies, and very specifically, it actually, when it lands inside of somebody's respiratory tract, it actually binds to these little molecules that alone can actually really affect people's cardiovascular systems. And so we believe that it has something to do with both the fact that those molecules to bind to are even there, which they're there and more present in older people. And they essentially, the downstream effects are just that it sort of throws off various parts of people's sort of normal physiology. And so the questions are really, unfortunately, and I think you'll find that in a lot of the answers, there's oftentimes many more questions than answers at this point in time with this virus. But we do know, of course, that it seems to be affecting older adults much more than younger individuals. And it probably is both related to the underlying immune status of individuals, plus this very complex biology of how the virus binds and interacts with human cells.
Okay, thank you. Our next question is jumping to the stay-at-home guidelines. Does the stay-at-home guideline mean stay inside my home? What is safe to do outside?
Yeah, so the stay-at-home guideline is really more about staying, it's really for your protection and for your neighbor's protection. But certainly, especially as we all know the weather is beautiful today, the stay-at-home guideline does not mean you have to stay inside. In fact, we would prefer that you go outside of your home and spend time in your yard or your garden. And by that I don't mean go out into the park with a lot of people, but if you have a backyard or a front yard or a porch, it's definitely okay to get outside. And in fact, being outside, if I'm assuming, you know, as we see people are gathering more and more as communities, hopefully those are generally small groups of people, if at all. Being outside is actually potentially a more safe way to get together with loved ones and family members. If you have a backyard or a porch and you can sit kind of outside and be at a decent distance from each other, and probably still be wearing a mask if possible, being outside in a well-ventilated area can actually really reduce chances of transmission. And so it's very important, I think, to get out, get into the sun, get outside, and not stay cooped up inside for too long, because we've all been cooped up in our homes, and especially in Boston area, you know, it's finally turning nice. And I would say that it is safe to go out into your yards. If you are going to be adventurous and sort of get out, you know, and I live right here in Jamaica Plain. You know, I see a lot of people walking around the pond, for example. I would say probably try to stay away from places that have a lot of people. So you want to stay away from very populated areas. But if you wear a mask and you're sort of outside walking around in a park and there's not a lot of people around you, that's generally a safe thing to do. And so stay at home guideline is usually, you know, it is morphing into something which is going to become a little bit more relaxed. But certainly for everyone who's listening to this, it is important to recognize, and I think you all know, that this is it can be a very severe disease in your age group. And it tends to increase considerably after 55 and even more after 65, and so on and so forth. And so it is very important, I would say, if you're going outside, try to stay, you know, in a place where it's really just going to be a very, very limited number of people. You know, we are working hard to figure out the best ways to keep everyone safe, figure out the best ways to develop masks that can be very protective. And I would say we're not quite there yet for all of these things. So the more you can kind of stay away from larger groups of people, the better.
And if someone in their backyard has 1 or 2 or 3 folks over, would you recommend mask wearing in that environment, as long as it's a large space where you have 6 feet in between, or not necessary?
I think it will be, I do think it'll be important to understand who you are, who the visitors are, and what their risk level is. And by that, I mean, if you know that the person that is joining you in your backyard is, you know, your child, and they've been extremely diligent with social distancing themselves. I think that, you know, if you're outside and you're far apart from each other, I think that there's the recommendation is still to try to wear a mask as much as possible. But sometimes, you know, if you're having a picnic outside or a barbecue or something, and, you know, everyone's distancing from each other, you can't always wear a mask. And so I think that making sure that you're doing, when you're taking off your masks, that everyone kind of is on board with recognizing where everyone else is feeling is very important. So if you're taking off your mask or they're taking off theirs, I think it's important for everyone to kind of be on the same page about whether this is a mask wearing endeavor or not. And when you are doing things like eating and they have to come off, I think just making sure to keep your distance. And in general, this virus is very transmissible, but we do find that being outdoors really does serve a pretty good, is a good way to reduce transmission. And with that in mind, I would also say that being indoors, if you're going to be indoors, a very good way, especially if you're having, you know, one person over or two people, opening windows is actually a very good way to keep airflow moving through your homes to also reduce transmission. So you don't only have to be outside to enjoy that benefit of reduced risk. You can actually open windows, and even just small cracks in windows can actually really improve airflow and reduce the sort of risk of transmission.
It's super helpful. Thank you for clarifying that. So speaking of inside, who can safely come inside my home was a common question that we received. And people asked about their friends, their housekeeper, a plumber, a home care aide. What precautions are needed? Can they use the bathroom? How long should they stay?
So these are really good and really tough questions. So who can come to your house and be inside? At this moment in time, it's a really, this is one of the most difficult questions to answer. The reason is we can't all have a crystal ball and know what everyone else has been up to. We don't necessarily know what risk other people have taken. So my advice is, as much as you can, is to keep the circle of people who come into your home small. Have it be people who you know recognize, have your best interest in mind, who you trust that they have been social distancing. You don't necessarily want somebody who may have just been at a party 2 days ago coming into your house. And so I would say that there are going to be times when you need to have other people come into the home. And when that occurs, for example, a plumber, just ensure that they're wearing a mask. And it turns out that masks can be very, very effective at preventing transmission. And I would also say that when you have somebody else in your home, particularly people who you don't necessarily know and who you don't understand their risk of being infected, make sure you're also wearing a mask when they come in so that both of you are masked. And that alone can really go a very long way to stop transmission. As far as precautions, yes, somebody can use the bathroom, but I would say to be careful. After they leave, you might want to spray with Lysol or something along those lines. You might want to actually clean the bathroom and clean the handles. And I don't think, there always needs to be a balance between how extraordinary your sort of activities are to keep yourself safe, but you also don't want to make yourself go crazy. And I think that that's really important to keep in mind. We have to balance all of these things that I'm talking about and saying everything that it needs to be in some moderation, without, just so that you can keep your sanity and keep some semblance of normalcy. And so if somebody goes to the bathroom, you don't have to hire people to do a deep clean of it, but maybe if you're going to touch the faucet after they left, make sure you wash your own hands, and probably still have some Lysol wipes or things along those lines. So it is important because, again, if these are people who you don't really know very well, they could bring the virus into your home. It's probably not going to be super common, but it can happen, and it can have bad effects if it does. And so I would say within reason and as much as you can, just be mindful of these activities.
And it sounds like if we open our windows, as these people come over, that would be helpful as well, and talk to them before they come out that they'll be expected to wear a mask, or ask them, kind of set that up in advance so it's not uncomfortable.
Absolutely. And, a lot of people, our society is certainly changing. It changed rapidly a couple of months ago, and it's changing again. And what I mean by that is people are emerging from their social distancing bubbles, and they are, some people will be starting to go back out into the world, and as though the social distancing has stopped. And I think it's very important, if you are in a high risk age group or high risk bracket in terms of other features of your health and your medical care, I think it's very important to let people know, to just let them know, hey, if you're coming in, I expect you to wear a mask. And in general, one thing that social distancing in the last few months have done is they have made everyone aware that it is an okay thing to ask somebody else to wear a mask. 3 months ago, it would have been very strange for all of us. But today, I think it's an absolutely reasonable thing. And frankly, they should be doing it for their own safety too. So I think it's okay if you have somebody else coming in your home that you're not familiar with, for any reason, that you ask them to wear a mask.
Okay. Speaking of cleaning faucet handles, what is the risk of getting the virus from touching a doorknob, countertops, groceries that an infected person has touched? And I think you already sort of answered this, but what is your advice for how older adults should deal with this risk?
Yeah, so this is a respiratory virus, and what that means, it's generally a virus that is mostly transmitting through through droplets that float in the air. And but we also know that those droplets land on surfaces. So if an infected person is speaking, and their droplets kind of land on a table, for example, and you go and touch that table right after they've been sitting there, there is a risk that you can pick up the virus on your hands and spread it to yourself. So I would suggest that as much as possible, and again, within reason, to try to just not touch things in the same way that maybe before you would walk around and you wouldn't think twice about putting your hand on a countertop, or having somebody else in front of you, taking the door for them. If somebody offers to hold the door for you, probably take them up on that offer and walk through while they're holding it, or use your foot to prop it open so that you're not having to touch a handle that maybe hundreds of other people before you have touched. So because there is a risk, and I would say one thing that everyone can do is to have those little hand sanitizer alcohol gels. And if you're going out into the world, just use it a lot. It won't hurt you. And every time you touch things, especially if you're grocery shopping, you can use that hand sanitizer, and it really shouldn't do much harm. If some of them can be a little bit, can cause a little bit of irritation. And if that's the case, you might be able to find other ones that don't cause so much irritation. But in general, I would say that there is a risk. It's not an extraordinarily high risk from touching things and picking up packages and things. But after you do, just use hand sanitizer or wash your hands.
So just to be super clear for people concerned about this, if somebody who might be infected touches one of these surfaces and we then touch the surface, we have a mask on, we don't touch our face, we use the hand sanitizer, that could be quite effective in reducing that risk or minimizing it almost to zero.
Absolutely. So the hand scent, by touching things with your hands, the virus won't infect you through your skin, for example. And so that's another benefit of wearing a mask when you're out in the world, is it stops you from touching your face so much. All of us touch our faces all the time, normally. And so wearing a mask is a really good way to stop yourself from touching your nose or your mouth because you have something literally covering it. And I would say that if you are wearing a mask, you can go about your life and you can touch things and you won't get infected just from that. And so if you use your hand sanitizer afterwards, then you should be it should put you in a very, very low risk of contracting the virus from those exposures.
Okay, great. So, what are the recommendations for older adults with respect to doctor appointments, things like mammograms and colonoscopies for preventive screening purposes, imaging procedures like MRIs? Are we safer waiting? And if so, waiting until when?
Another very, very good and difficult question. And this will really have to do with individual risk. I think this answer will change over time. At the moment, there is a fairly low number of cases in the community. And 2 months ago, I would say absolutely try to do everything you can to not go to your doctor, especially if your doctor is in a hospital, for example. Today, we're seeing cases are dropping. And so the number of people who are out in the environment who have this infection right now is decreasing. So that's a good thing because it reduces risk to everyone. So I think that it's a very good idea to call up your doctor before you go to the appointment and ask them, is it safe for me to come to my appointment, today or tomorrow, whenever it might be. And if the doctor says, well, actually, there was just a big outbreak here, then maybe that's not the day that you want to go, and you might want to reevaluate and find a new time. But if they say, we're taking all of our precautions that we can, everyone's wearing a mask, we haven't had a single case, in months, then I would say it's important to make sure you get to your doctor's appointment. And we know, for example, that some people you don't want to find yourself foregoing necessary medical care because you're concerned or afraid to go to the physician. A lot of doctors' offices right now are really working very hard, including the hospitals, to do everything they absolutely can to prevent transmission from happening in the hospital or in the doctor's office. So I would ask questions. If it's a hospital like Brigham and Women's Hospital, there's a lot of precautions currently being taken. There's very few people allowed in. Everyone who's going in is wearing a mask. And there's been very little transmission within the hospital. If it's an outpatient setting that you might not be so familiar with, I would call up and I would ask, are there any active infections there right now? And you can even ask what kinds of precautions, and as your physician, do they recommend that you come in? And I think physicians will generally recognize your health status. They'll know who you are, and hopefully they will give you a very honest answer about whether they feel it's been safe. And that should hopefully be informed by how many patients they've maybe seen with coronavirus in the recent past.
So here, when in doubt, call and find out, get some advice, don't ignore symptoms or concerns and so on. And I just want to come more from the geriatric world in my work and falls prevention and fractures prevention. And it's incredibly important to not just consider your doctor appointments, but also your vision, your audiology, especially your dental care. These are all things that very much impact your everyday functioning and ability to be safe. So don't put those to the side and wait too long either. Phone your dentist, phone your ophthalmologist, and so on.
Yeah, I will on that same, I think it's very important for what's gotten a little bit lost in all of the messaging and the media is the focus has been so much on coronavirus, but for a lot of people, especially people who are, very much older in life, there are other risks that are potentially, there's a lot of risks that happen to people every day. So I think it's just very important to keep in mind that you don't want to be putting yourself at more risk by not taking care of your health care. If you're on medications that you have to take routinely or daily, don't not get those because you're worried about coronavirus. Talk to your physician, talk to your pharmacist, figure out how to get those medicines. The last thing you want to do is to put yourself in greater harm's way than the virus would have done.
Great words of wisdom. Okay, now to something less medical. What everyone's asking, is there a best practice for getting a haircut?
Well, this made the national media recently. There was just two, I forget where they were, but two haircutters were working, and they were actually both sick and symptomatic with this virus. And they cut something like 150 people's hair, and none of those people got sick in the process. And that's because both the hair cutter and the individuals who were getting their hair cut were wearing masks. And hopefully we're not touching their faces and their eyes in the process as well. And what that tells us is that these small interventions can be just so powerfully effective that they can actually allow you to go and get a haircut. And I would say just make sure that you're wearing your mask well, that it's, and you don't want to just have, if you haven't gotten yourself a good mask, and I forget if we have a question about what kind of mask, but there's different qualities of masks. But if you're going to get a haircut or you're going out to a place that you really don't know who else has been there, you want to wear a mask that's going to protect you. So some of those might be surgical masks that you can order. And there's a number of different mask qualities out there. But what you want to make sure is you don't necessarily just want to wrap a t-shirt around your face. It might look like a mask, but it might not do a tremendous amount relative to a good surgical mask and some others. So, but I would say that just doing that, and again, making sure that you're washing your hands before you touch your face or anything else, I think will be a good way to keep yourself safe while getting a haircut.
So it sounds like if you really need one, you're able to do it quite safely.
Yeah, and for men, and women, I have these little shavers that I just buy, and I think, had I bought stock in one of these haircutting do-it-yourself shaver kits a long time ago, I probably would be wealthy now after this pandemic. But these are really useful tools to buy, and if you can cut your hair on your own at home, or have your significant other or your child or somebody cut your hair for you, go for it. It's safer.
Okay, I'm not going to have my husband cut my hair anytime soon. But I did go to a salon that was very, very strict, including taking my temperature when I entered. So there's a lot of people doing really great prevention in their everyday, really doing a great service.
Yeah.
Okay, so just want to be mindful of the time, almost at 7:40. I live in an elevator building, and my daughter insists that I not leave my apartment under any circumstances. She brings me what I need and drops it by my door, and we speak at a distance because she is fearful about infecting me with the virus. Is this all necessary?
I think that this will have to do with what that daughter or son or whoever it is, what their risk profile looks like. If it's somebody who is at high risk of getting the virus, then this might be necessary. If it's somebody who, for example, is a dentist and has been seeing a lot of patients and then finds out that one of their patients was infected, that's probably not a good time for that individual to come and visit you. But if, on the other hand, this is a daughter, a son, or a loved one who has also been has been very careful not to get infected, has been diligent about wearing masks, this kind of falls into the realm of we have to continue living as a society, and we have to function as humans. And part of functioning as humans has always included risk. We all get in a car, and every time we get in a car, there's risk to that. So we recognize that there is some level of tolerable risk for all of us. But it's also seeing people, and we have to, being with people is just extremely important, I think. And you don't necessarily want to have that person come in if they were, if they were just at the protests, for example, and really don't know if they might have gotten infected even though they were wearing a mask. That might not be a good time for them to come over. But somebody who's mostly been staying indoors, just being very careful, doing most social distancing appropriately, I think it's a risk that is worth taking, and that's going to be everyone's individual risk. But I would say that right now the community risk is pretty low in our communities. Most of you are in Newton, and so the risk is, there's not a lot of cases around you right now. So if a loved one is coming over and they're from the same area where there's very low risk, low prevalence of the virus out in the community, I think that it's okay. And but it is going to be dependent on your own individual tolerance for risk. I can't get up here and say that there will be zero risk of infection, but I can say that right now it's pretty darn low, and I think that it's very important for people to be in the company of their loved ones and their family members.
And I believe it was just a week ago that Senior Services had a very well-attended Zoom meeting on social isolation. And it's a very important factor. Again, it's a risk factor for health outcomes, and social connection is very key to all of our mental health.
Yeah.
Okay. You may have already addressed this. Should we skip over this or keep with it?
Well, I'll answer one point to it.
Let me go ahead and read it then, just in case people can't see.
Mm-hmm.
What is the point of wearing masks? Do masks work by protecting the wearer from others or from protecting others from the wearer? Do I have to wear a mask whenever I go outside?
So the purpose of the masks are, there was a lot of confusion earlier on in this epidemic because there was mixed messaging coming from the CDC and the NIH. And our government was a little bit confused themselves about what the role of masks were. And, it was actually because they were trying to preserve the number of masks available to healthcare workers. And so they said at one point that you only have to wear masks if you were infected. In reality, masks work in both directions. They work very well if you are sick and you know that you have this virus. They can work very well to prevent you from transmitting it to others. And again, that's because this virus moves in droplets. And so if you cough and you have a mask on, those droplets generally won't penetrate the mask and they won't go through. So they can be very important there, but they are also very important for a fully healthy person just to wear to prevent those same viral particles from getting in. It's not going to be 100% effective, but if two people are wearing a mask and one of them is sick, that just those masks alone can help stop around 90% of transmission. So it can be very, very important. And whether you have to wear a mask when you go outside, I would say if you're going out into your own yard or you're just walking up and down your street and nobody else is around and it's a quiet street, I think that it's okay not to wear a mask. If you're just kind of staying to yourself. There's a really important piece about wearing a mask that I think we all need, I mentioned it earlier a bit, that we all need to be aware of, is that even if you're sure that you're not sick and even if you're not concerned about getting sick, other people around you are very concerned about getting sick. And so if for no other reason, wearing a mask to do a good service because other people really, it's a very scary thing, especially for people in your age brackets. And so just recognizing that when you're walking around, it's not just about your protection, it's about other people's, their protection and their feeling of being protected while they're out in the environment. So in general, if you think that there's any chance that you'll be walking past people, I do think it's a good idea to wear a mask when you're outside.
Okay. Since testing and contact tracing seems to help detect cases, I wonder if before older adults re-enter the community, it would be helpful for us to be tested.
Yes, I think so. I think it's if you've been social distancing though, and if you've been in your homes, the chances that you would have this virus is very, very low. So I don't know that it's as important for if you've been inside and you're in your home, and not and it's not a community area, but it's kind of like a freestanding home, for example. Then you probably actually don't need to get tested before you go out and venture out into the world. The chances of you having caught the virus would probably be very low. And so I don't think that that should stop you from, if you need to go and pick up groceries, that shouldn't be a reason that you can't pick up groceries. On the other hand, if you are living in a center, in an assisted living center, or just I'm forgetting the, any sort of senior living center or some sort of condominium, and you're not sure if you might be picking it up just as you're walking around your own facility, then in that case, I hope that you can check with your facility and see, do they offer testing? Especially if you have any reason to believe you might have been exposed, then I would say it does help. But otherwise, if you've generally been indoors or have been very, very safe and you have had very low contact, I would say it's not necessary per se to get tested each time you go out. Now that said, if you're coming back into an assisted living facility or coming back into a senior center, I do think that is a different question. And the coming back in from the town piece of it can be, all different locations are dealing with that, how to deal with that in different ways. And some are actually asking people just not to leave. And if they do leave, they have to come back and self-isolate for 14 days. And so I think that that's, at this moment in time, it's just so dangerous for this virus to come into an assisted living or a nursing home type of place, that unfortunately those extraordinary efforts to stop transmission, I think, are very important. And so I think if you're in a location that's going to ask you to quarantine for 14 days before, if you come back after going away for a weekend, it unfortunately, you should really consider, what is that weekend or that visit out to town worth if it means that you're going to have to stay indoors in your own apartment for 14 days. And understanding those trade-offs is going to be increasingly important, I think.
Okay. I have heard a lot of conflicting information about COVID testing. What do we as older adults need to know?
Well, I think there's two main types of tests. You've probably heard, or maybe some of you have even gotten the nasal swab. And this is a type of test that looks for the virus. And the main COVID test that I'm talking about is generally looking for active infection. It's looking for people who are currently infected today at the time that nasal swab is performed. And so the nasal swab, if you haven't gotten it, it looks it doesn't look comfortable, but it's actually not bad. It's just a swab that goes kind of into your nose and touches the back of your nose, but it's really not a painful experience. It's not comfortable per se, but it's not painful. And so that type of test will let you know if you are infected at that moment in time. There's a different kind of test. And I would say if you're positive for that kind of test, then you probably should not see anyone else for at least 10 to 14 days. You should, if you have to move around, you should have somebody try to bring you your food and sort of leave it outside, and you pick it up after they have gone. So you want to be very careful if you find out that you're positive, that you don't infect anyone else around you. There's a different kind of test, which has been a really confusing one for people. And this is an antibody test. You might have seen the word serology, antibody, blood test. This is a test that actually asks the question, have you been exposed to this virus? Have you seen the virus? Have you already been infected with it? And what has been confusing is that earlier in the epidemic, some of the tests were really not accurate. They were telling people they were positive when they weren't, and negative when they weren't. But now we know that the tests have become very accurate. So there are tests that can reliably let you know, do you have what's called an antibody to the virus? You could think of the antibodies as sort of like a historical record. Every time you get infected with a pathogen like a virus, your body keeps a record of it, just like a hard drive on a computer, just like writing in a journal. It actually records it, and the record is called an antibody. And so we can actually look for those antibodies in your blood and say, does this person have a record of being infected? And that's what the antibody test is looking for. But it goes one step further, and it also potentially one day will be able to let us know if you're protected from this virus. And that's because if you've been infected before or vaccinated, if a vaccine becomes available, your body forms antibodies. And those little markers, those historical records, can actually work to protect you from second infections or third infections. And so eventually we might find that these antibody or serology tests will actually be able to let you know how, if you are protected from this virus or not. At the moment, we don't really know how to interpret them, except to say, you have seen this virus in your past. And at this point, it would mean you have seen this virus sometime in the last 2 or 3 months. We're continuing to improve these tests to understand more and more about what they mean and how to interpret them. And so those are really the two different tests. One is the antibodies, and one is the virus. Antibodies give you history of your exposures and looking for the virus itself. With the nasal swab lets you know if you're infected now.
Okay, great. My grandson is 7 years old. I do not live with him. Are there safe ways that I can visit and cuddle with him? Lack of touch is getting very painful.
Well, I can say that my parents are asking this very question, and it's a really difficult question. And I would say that at the moment, for example, school is out. Most children are not in school. So if the child has been doing a good job at just staying in their home with their parents, I think that there is a role for to see your grandson. However, if that grandson has been playing with friends and going, to a lot of other people's homes, which we're starting to see more and more of, because just like it's important for all of us to have contact, kids really need to be in contact with other kids for their development. And so many children are starting to go and explore and be around many other friends again. And I would suggest that if that's the case, if your grandchild is coming to visit you and you know that you're going to see them on Saturday, then maybe you ask them to try to get a virus test the day before, 2 days before they come to visit you. And if they're negative, then great. That's terrific. There are even some virus tests that give you rapid results that can give somebody, so somebody could go through a drive-through at a CVS and potentially get a result within an hour. Most of them are a day delay. But if you live near a place where you can get a quick, rapid result, then that can actually be a really good way to feel very safe if somebody comes over to your home, that they're probably not infected. And so I think that looking forward, we're going to see tests become increasingly available, including these really rapid tests. And so it will be something that I think will become a little bit more part of our normal life, is that if you're going to visit grandma and grandpa, you get a virus test beforehand. At the moment, it's a little bit inconvenient. There aren't a lot of these places to get really rapid tests, but there are a lot of places to get tested. So if they're coming over on Saturday, maybe ask them to get tested on Thursday. They might have results on Friday, and then you can feel good about having them come over on Saturday.
So almost a cuddle test.
That's right. Yeah, that's exactly right.
And if they have the test for the virus and you do have to wait a day or two, then that grandchild should isolate until you're going to be together, I presume.
That's right. I would say that that would be the important piece to that, would be to isolate. It's still not 100%, and I think that that's important to recognize. People can be negative and then, one day and then turn positive the next day. But in general, if they've been safe and they've been, social distancing, and if they know that they're coming to visit you on Saturday, maybe, they take more precautions the week before and get tested on that Thursday. I think that that would be a good way to go.
And just to wrap things up, so at this point, if the grandchild had a virus test, is that an accurate test? Can we be for sure safe that she or he probably doesn't have the virus?
It's a pretty accurate test, but it's not perfect. The virus can be a little sneaky. Sometimes it doesn't get picked up by the swab that goes in the nose. Sometimes it's in the mouth instead. And so it's a little bit difficult to say exactly, whether or not it's not perfect, but it's very good in general. And if somebody's negative, that generally means that they're not going to be transmitting the virus to you. So I would say nothing's perfect, but these tests are pretty accurate in general. I would say if the child, even with a negative test, if they or the person bringing them over feels, you know, any symptoms at all, it's better to play it safe and maybe ask them not to come that week. If they have a headache, if they have a cough, you know, that's important. And even, you know, it might not be coronavirus, but even the flu, you don't want somebody bringing the flu into your home, which is also dangerous. So it's important, you know, if they have symptoms, probably not to visit.
So this brings us to the top of the hour, to 8 o'clock. And I know that many of us would want to keep going on for a long time, but a 1-hour Zoom tends to be the upper limit. And I would like to thank Dr. Minna for sharing his time with us, his valuable time, and thank the audience for all these great questions. We apologize if we couldn't get to your specific question. If you'd like, you can contact us maybe through the Senior Center or myself, and we can see if we can help you get an answer. I wanted to close with some words from Catherine Esty, an 85-year-old author from Concord, featured in the Globe last Sunday. And I quote, "I think the hardest part of this pandemic for younger people is the unbearable uncertainty. But those of us in our 80s have survived so much: the Depression, World War II, Vietnam, financial crises. We live with uncertainty every day. We've learned to accept that life isn't going to go on forever, and we need to live in the present. We've learned to manage losses and have learned to grieve, which is really a skill. We are all survivors of some kind," unquote. We are in this epidemic together, and the actions you have already taken have already helped to keep you safe and control the epidemic. The main take-home message from our discussion tonight is to keep up your vigilance with distancing, mask wearing, and hand washing, and prioritize your health so that if you are exposed to this virus, you will not be as vulnerable. As you probably tell your friends and offspring and your parents told you, eat well, exercise, and get enough sleep. Do not neglect your health care, including medical, dental, eye, and audiology. Be sure to continue with those activities that matter most, such as socializing with friends and family, while still following the guidelines to reduce risk. For final remarks, I'd like to pass the microphone to Jane Colino, Director of Senior Services.
Thank you, Lisa. Thank you, Dr. Minna. Thank you, Alana Seidman, who's been the Wizard of Oz behind the screen, making sure all the controls and everything went well. I want to acknowledge the Newton Council on Aging, and there are many members here in the meeting tonight. The Council on Aging is appointed by the mayor and the city council to do things just like what we're doing tonight. And earlier this morning when we met with Dr. Minna as a planning session, I thanked him for empowering the Department of Senior Services and therefore empowering the residents of Newton to understand how we can continue to engage in the safest way possible. This came out of a conversation at the executive committee, the Council on Aging Executive Committee. And a lot of people are feeling helpless during this time. And I hope that this session has really helped people to feel not helpless. Although the Newton Senior Center closed on March 14th as a building to the public, the Department of Senior Services did not. And we are continuing to provide essential services, including the provision of masks to people who may have difficulty accessing them, either financially or just from an accessibility point of view. We are delivering food every day to people who can't get out and have access to food. We're grocery shopping, picking up prescriptions and other essential items that people may have the need for. And we recently received a community development block grant fund to help people underwrite some of those services. So although the building is quiet and it's echoey on the inside, there is a lot of essential services that are still available to you and those of your friends who may need them. Again, I just want to thank everybody, the mayor's office, Dr. Minna, the Council on Aging, and all of you for attending tonight. And please spread the word for what you learned tonight. Thank you, everybody.
Good night. Thank you. Bye.